Everyone set? Good morning. We have 3 new cases of COVID-19 in Queensland. 2 of them are overseas acquired and detected in hotel quarantine. 1 is a new local case not linked to the current clusters. It's a woman in her 50s who lives in Fitzgibbon. You'll have seen a range of new contact locations have been added to the Queensland Health website. She was infectious in the community, we believe, for 10 days. So there's a large number of new locations. She went and got tested, and that's exactly what we need Queenslanders to do. If they have any symptoms, that is what will allow us to identify if there are any new cases out there in the Queensland community. That leaves us with 26 active cases. We did 9,411 tests in the last 24-hour period, which is a great result for a Sunday of a long weekend, and we did 14,983 vaccines, including some to punters who were turning up to see the football last night. I was pleased to stop in by the vaccination centre and see the fantastic staff working on the long weekend to get Queenslanders vaccinated. And the other update that the Chief Health Officer will provide is just some changes to the border zone arrangements, reciprocating the decision of the New South Wales government to increase restrictions in the Lismore area.
Thank you, Deputy Premier. Yes, good morning. So those 3 new cases, one of them is a new locally acquired case who's been infectious in the community since the 23rd of September. So it's really important that anyone who lives in that Fitzgibbon area, or indeed anywhere from Redcliffe down through Chermside to Cannon Hill, please, any symptoms at all, come and get tested. I'm reassured that we have done well over 100,000 tests in the southeast corner over the last week, and we've not picked up any other chains of transmission. But we now do know we have this case that tested positive, and we got those results yesterday. We do have this case, so I encourage and please ask anyone who lives particularly in the northern part of Brisbane to come forward and get tested, even if you have the mildest of symptoms, so we can make sure that there hasn't been any onward spread from this individual. So we will get genome sequencing back to try and work out where this person's acquired the infection. At this stage, there are no close links that we've been able to identify. She hasn't been to any known exposure sites. So all of the exposure sites that she's been at while infectious are up on our website, and we'll continue to work with her to make sure that we've picked all of those up. Then, as you heard from the Deputy Premier, Lismore has gone back into stay-at-home restrictions put in place by the New South Wales Government. So from 1 a.m. tomorrow, we'll put our enhanced restrictions in place so that there are very, very few reasons for anyone to be able to travel into the Lismore LGA and then come back into Queensland. Thank you.
I know previously in terms of lockdowns, we talked about an unlinked case will send us into lockdown. Is that where we're at the moment in this case?
Well, the only thing that's reassuring me is the amount of testing we've done. So this has happened at the same time that we've had those restrictions in place and that enhanced testing. So I'd like to see more testing just to make sure we haven't missed anything. But she's been out and about and we haven't seen any cases. She also is double vaccinated, so she's fully vaccinated. Her second dose was back in August, and her household members are all negative. So there are 3 other people in that household, and none of those have tested positive. So I am reasonably reassured by all that, but it would be good to see that enhanced testing response that we see every single time from Queenslanders.
When do you expect to get those results back?
For the
Genomic testing.
later today, I would think I'll get that back.
And if it comes back that it's unrelated to the current clusters, do you expect to recommend a lockdown?
Well, no, as I'm saying, I am very, very comfortable with the large amount of testing that we haven't seen any cases. It's coincidental this has happened at a time of increased testing. So if we hadn't have had all of that increased testing, I'd be more cautious. But at this point in time, I think with that increased testing, the fact that she's double vaccinated, the fact that her household members are all negative is reassuring. So I just need that increased testing to make sure that we don't have any transmission going on. Yes, that's correct. Yes, so we are, of course, immediately contact tracing all of those people and testing them. But so far, we haven't found any positives related to her.
So she was working in the massage?
Yes, 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 she was.
And just to be clear, she and her household members didn't go to football though?
No.
Just on the NRL, a lot of the pictures and images last night, not a lot of masks being worn at the game. Were you disappointed to see that?
I'm told that a lot of masks were worn till people sat down, and then once they sat down, they took them off. So people, once you sit down and you're eating or drinking, of course you can remove the mask.
It went beyond that though. I mean,
I wasn't there, so I can't comment.
Deputy Mayor, were you at the game last night?
I was.
Yeah. What did you think of the mask wearing?
Certainly, I think compliance with mask wearing in and out of the stadium until people got to their seats, I thought was very high. And obviously, once people sit down, and then many of them had beers and food and that kind of thing, and taking masks on and off to deal with that. So no, I think compliance was very, very good, particularly where there's that risk of intermingling, which is really about when people are moving around the stadium.
But in terms of that, we spoke to the Premier last week about that, and specifically about how businesses, restaurants, cafes who have been subject to these new restrictions of one person per 4 square metres, and many of them have been critical about 40,000 people being allowed into the stadium while that was happening, and the Premier assured us, well, when they go and sit down, they need to wear a mask. But it really looks like that didn't happen, did it?
Well, a lot of people at the game that I saw were eating and drinking, and while they were eating and drinking, they were permitted to remove their mask. While they were moving around, they were by and large wearing their masks, and that's when the risk is greatest. I think there's a lot of ways to see downsides in all of this. I think the fact that Brisbane, Suncorp Stadium hosted the grand final last night, we did a great job. It was a fantastic game. I think there's lots of good things to take out of yesterday.
There are plenty of good things, and everyone went really well. But in terms of fairness for businesses and restaurants and cafes who are suffering financially, how do you think they felt watching that last night?
Well, look, when you go to a cafe and you sit down and get a drink, a cup of coffee or a glass of water, you can then remove your mask. Now, most of the people I saw at the stadium had food or drink, they were eating or drinking, and while they removed their mask. That's the same rule that applies in other hospitality venues, and then when they got up to go to the toilet or to leave the stadium, they put their mask on. I don't have numbers to hand, but I'm sure there'll be a police representative.
Will you follow Victoria's lead and mandate vaccination for all essential workers?
I might let Dr. Young just reflect on what advice she might provide there.
Yes, so we're gradually going through all of our high-risk areas and strongly recommending mandating, but we're just working that through. So at the moment you would have seen that all our hospitals, that all staff who work in a hospital and have interaction with patients or work on that site need to be vaccinated, and we had a superb response to that with very few people not being vaccinated. In fact, the majority of those were people who are on leave anyway. And then, as you've seen, police have mandated vaccination. This stage we're strongly encouraging within our corrective services that staff there be vaccinated, and of course we're strongly encouraging it for disability workers as well. So we're just working that through.
What about the construction industry?
No, there's not been any discussion with the construction industry. Of course, I'm out here every day encouraging everyone who's 12 years of age or older to be vaccinated, because we know, particularly with the Delta variant that has a replication number, an R0 of 8, it will be very, very difficult once this virus starts circulating for people who aren't vaccinated to escape getting infected. And we know that they are the people who are then going to be at risk of needing to go to hospital and then potentially ICU.
How sick was she, and have people been checking in on those exposure sites that you're happy to?
There's been some check-ins happen, but possibly not as many as I'd like. So it's really important that anyone who lives in that northern part of Brisbane really has a look at the website and checks whether or not they've been to any of the venues listed.
Are you concerned, given that was the most amount of people who've seen the NRL Grand Final in a long time, that there could be more cases over the next few days?
No, I think we've had 100% capacity for quite a few games. I must admit I haven't regularly been to the football, but I believe we've had more people than that. Yes. I'm sorry, I can't understand you behind the mask. Right, so we don't yet have 100% vaccination in our aged care facilities. We're getting there, and I would hope that once we get there we won't need to have those restrictions in place. But at the moment, between our general community, which is not yet at those high enough levels, and our aged care, that it's still too high a risk. So we have seen deaths in aged care still in New South Wales and Victoria. We know it's one of our most vulnerable settings. So that's why we do need to have those restrictions continue for a bit longer. Yes, so we put the restrictions in for 2 weeks. Yes.
Are you happy with how the current protocol arrangements are working with this, like in and out of restricted zones, given that KO case from last week was able to be infected coming to Queensland days before New South Wales authorities even locked it down?
It is difficult, so I really would like people to limit their movement into northern New South Wales. So people should only be going into northern New South Wales for those very few essential reasons. As we can see, every day New South Wales moves parts of that northern border zone in and out of lockdown, and it is difficult for people to manage that and understand it. So I think the best advice is just at the moment, while New South Wales gets their cases under control, and each day we're seeing fewer cases in New South Wales, which is an excellent thing, that limit your movement in and out of northern New South Wales. I would prefer that people limit their movement in and out of northern New South Wales just for the time being until all those cases are brought under control.
The public holiday today, are you worried about a reduction in the amount of testing clinics that are open for people?
No, we have our clinics, and thank you for raising it, all of our vaccine clinics, they're all open today, and anyone in Queensland, no matter where you are, can walk in to one of our vaccine clinics. You don't need a booking, and if you've got the time today and you've got a booking and you're beyond that 3 weeks or 4 weeks for Moderna or 12 weeks for AstraZeneca, just come in early, get your second dose, and we'll cancel that future booking that you've got. So this is a time, as we're seeing more and more incursions of the virus into Queensland, to get yourself fully protected. So thank you for that question.
Vaccinations for aged care and hospitals, is that 100% of staff and residents, or does staff and all the lockdowns in hospitals stop once 100% of staff?
My preference, of course, is that every single person who's 12 years of age or older gets vaccinated as quickly as they can. We've got plenty of vaccine, we've got plenty of places to vaccinate, so it's really, really important. And that's across for vulnerable people and non-vulnerable people.
Has raised concerns about branding in Queensland hospitals, given we could see that inevitably or Delta outbreak you've spoken about, they want real-time data so we can manage their capacity. Do we need to look at that, and are you happy the health system can cope?
Right, we do have real-time data, so we manage it. That's why ambulances don't always necessarily go to their closest hospital. Sometimes they're diverted to other hospitals because we have that real-time data of hospital demand and of ambulance demand. The most important thing that all of us can do to help our hospitals going forward so that we can continue to treat everyone, whether or not they've got COVID, is to get vaccinated. We know that decreases the need for hospitalisation. So it's really, really important going forward. Everyone aged 12 years of age or older gets vaccinated.
About the hospital. So I think a week ago you said they are ready. Is that something you believe they are ready?
Oh yeah, they are, and they've been well prepared now for more than 18 months since that initial modelling. But our hospitals cope all the time with unexpected demand, but they cope better when they know what to expect, and that's what better modelling about what the nationally agreed plan for opening up, what impact it will have on hospitals. Because while they will cope, there will be an impact. Hospitals in New South Wales and Victoria have dramatically scaled back non-urgent elective surgery. We treat more than 10,000 non-urgent elective surgery patients in our hospitals each and every month. So that's tens of thousands of Queenslanders who've been treated because we are not in lockdown and we're not dealing with lots of cases. And so the better we can model out what that demand will look like, the better we'll be able to make sure we can continue to do all of the other fantastic work that our healthcare staff do. They've been working on this pandemic for a very long time now. Some of them are stretched. They're working through weekends to keep testing clinics open, to keep vaccinating people. They are doing a lot of work, and I think we owe it to them to be measured, to properly plan and expect for what might happen at different levels of vaccination and at different caseloads, particularly when you see what's happening in New South Wales and Victoria. Sorry?
Do we have a problem with capacity?
Well, our hospitals are very well equipped and prepared for whatever might come. But I think, as I said, we owe it to our fantastic healthcare staff to do the best we can to manage those impacts and to be prepared, to know what to expect. And really, that's all we've been asking for, is for National Cabinet to properly consider, to have that detail and to properly consider what the impacts might be, because while they will cope, there will be impacts. And what you've seen is every state and territory wrote to the Commonwealth and asked for extra support for our hospitals. Our hospitals are jointly run and funded. They are funded under a national partnership agreement. Partnership is the key word there. Both states, territories and the Commonwealth have agreed to fund 50% of all activity growth. But the federal government have artificially capped that growth funding at 6.5%, regardless of how much demand grows. And they did that before the pandemic. What we're saying now is that the pandemic will clearly drive demand that is greater than that. And given that our hospitals are funded as a partnership, we would like the federal government to increase their contribution to that partnership.
And a lot of health workers have messaged us saying that the government was going to send unvaccinated health workers on leave, but it's now back down. Non-vaccinated workers are allowed to be going to hospitals, ambulances, if they wear a mask. Can you just clarify what is exactly the situation at the moment?
I might let Dr. Young.
Yes, so there's a very small number who aren't vaccinated, and a lot of them were already on leave, for instance maternity leave, long service leave. Of the remaining, there's only a very few, and we're working with each of those people as individuals to see what their reason for not being vaccinated is. As we all know, there are a very small number of reasons that people can't be vaccinated, a very small number. So we're just working through whether these people have one of those conditions, so whether we need to look at it to redeploy them or what we need to do. So we're just working that through, but it's a tiny number.
But the specific message is like anti-vaxxer staff are allowed to be going to work at the moment with a mask. Is that happening?
No, we are working through with each individual person, and there's a tiny number. It is really a very small number. So we're working through with those what happens going forward. It's small.
Thousands or hundreds?
I don't have it on me, but it's small. Yeah.
Is this a rough figure, like 50, 100, 200?
I don't have it.
But you know, it's small.
It's small, yes, it's small. It didn't affect our rosters. It didn't affect patient care. We could manage
Is
it.
it not affecting rosters because actually what they're saying is unvaccinated staff, and we have seen unvaccinated staff cause outbreaks before in lockdowns. Unvaccinated staff are currently in Queensland Health allowed to go to them.
We're working that through, so they can't in any of our COVID hospitals. You know, we've got those 5 hospitals and they've been vaccinated for quite some time now, and we're just working through with the other hospitals, remembering we don't have an outbreak in Queensland today. So we don't have a risk there at the moment, but we're working that through so that we're prepared for when we do end up with an outbreak. But there's not a rush. We've got time to sort it out.
Unvaccinated staff are currently able to work in Queensland Health.
It depends where they're working and what they're doing. So, no. The plan is that there won't be unvaccinated staff working in Queensland Health hospitals. We're currently working with the private sector, what will happen there, and with non-hospital primary care sectors, what will happen there.
How concerned are you about vaccination rates outside the cities?
Throughout our state, I would of course like to see our vaccine numbers go up. They are going up every single day, but I'd like to see them go up faster. I think we've got a little window before we'll start seeing widespread community spread of the virus, and we need to take the opportunity to get everyone vaccinated.
And to be able to just clarify just about some more about airport.
Yes. Yeah, so that was one of those pilots, you know, our aviation cluster that we haven't had any cases the last couple of days. One of the pilots, when we've gone back and spoken with him again, we think he was possibly infectious when he flew into Moranbah. We're not sure, but to be ultra cautious, we've listed that site. So that company, all of their staff virtually have been double vaccinated, and sometimes we know that can lead to problems working out when someone's been infectious. So we just went through, because we got some other information that suggested he might have been infectious a bit earlier than we initially thought.
But on the masseuse, so 10 days infectious in the community. When
Yep.
was she developing symptoms, do you know?
From the 25th, yeah. That's
be
right.
great if
Let
you
me
came-
just check.
How old is she?
She's in her 50s, yeah. So, yes, that's correct. She started developing symptoms on the 25th.
And was she still working during so she's still working while she's symptomatic?
Yes.
Obviously concerned.
Well, it is, but again, she was double vaccinated and she had mild symptoms, and that's why I'm always out there saying, please come forward as soon as you develop any symptoms, no matter how mild.
Just quickly on that, back on the hospitals, obviously we've heard from Bryce Hill, who's the events care paramedic. He's stuck in the state and can't get home. Why doesn't the government try to fast track people like him to get home? I mean, we're clearly struggling with demand in the ambulance and health system.
Well, frankly, our health system and our healthcare settings are the last place we'd be taking those kinds of risks, because they're the highest risk places. And so whether that's in a hospital or a paramedic, we would want to be very risk averse and avoid the risk of bringing COVID from another state and giving.
Way to quarantine, so we can do his quarantine and then get back to work. Because every day he's stuck down there. And stuff.
Well,
and there are Queensland health workers, the only one that's stuck in the state and they can't get back to home, so quarantine, can't get back to work.
Well, I suspect, Tim, that if we were putting our workers ahead of other Queenslanders wanting to come back, you'd be here accusing us of having double standards and preferential treatment. I am happy for the Chief Health Officer to go to the specifics of that particular case, but there is a process for us to bring people back and put them through hotel quarantine, and that process applies to everybody equally, whether you work for Queensland Health or not.
Are you planning to reapproach New South Wales authorities about shipping and border checkpoints that was put in once they the restrictions are up?
I understand the likely successors there had perhaps even stronger views than their predecessors. So, we've asked multiple times. Our requests have been declined. What we continue to do is reciprocate the arrangements put in place by New South Wales. That's what you see again today, with Lismore being added back into the border closure zone, and we'll continue to do that.
So is there any criticism about that? If you put back frontline healthcare workers, you think you'd be criticised?
I'm constantly surprised by the things you criticise me for, Tim. So yes, I think. Well, no, as I say. Well, as I say, it's actually incredibly important that healthcare workers comply with these rules. More important than others, because they're going into high-risk settings. They're dealing with vulnerable patients.
All right, we're out of time. Thank you.
Thank you.